have experienced depression, and I would call it situational depression, because at that point in time, something happened to me and my family. We experienced a flood. We were living in a house in Lagos, Maryland, part of Lagos to be precise, and it was not, obviously, it was not well built. The rains came around this time, it was rainy season, and we experienced a flood. It was crazy. The flood was knee deep. Our home, our equipment, TV, couches, you understand what I mean? All your furniture, fridge, also everything you can think of were damaged, right? So we lost a lot of items, but we are grateful to God that none of us lost our lives. I'm happy that when the flood happened, at that point in time, my son, now 3-year-old, but he was 1 year at that point, he was at grandma's, and so he was not in the house when the flooding happened. Funny enough, his bed, obviously you guys know those cots, those sleeping cots that are really, really low, and that's where he would have been sleeping when the flood would have come. His life may have, we'll probably not be having this conversation right now. I don't know if I did not overcome some form of grief. But anyway, the point was that we had this thing happen to us. We had to obviously move out of the house. We started living with my dad. The three of us were now living in my old room in my dad's house. We moved, we tried to salvage whatever was left of our property. We were there for about 3 to 4 months. So this happened to us. Yeah, for real, this is true story. It happened to us. The landlord said that he was not going to return the money. We had stayed, I think, maybe only about 7 months. Right? And we needed our money back because we needed to get money to rent another place, right? To recover things that we had lost or try to replace them gradually. Where we were now staying with my dad in my old room in my dad's house was twice the distance in terms of from the house to where I worked. So we were spending more. We were spending more on transportation. We were losing money. It was really, really bad. And so after this flood that we experienced, I really, really got down into a state of depression. I was feeling funky. I didn't want to go to work. Even when I went to work, I wasn't performing at my best. Some people did not, almost everybody did not know because I kept it to myself. People at work did not know. The only reason why I had to confide in my direct line manager was because, he noticed that I wasn't performing. I wasn't at my best at all at work. Even with my friends, I secluded myself. I isolated myself. I couldn't bring myself to say, oh, this is what is happening to me. I felt guilty. I felt ashamed. I was in a really deep state of depression. So I just wanted you guys to understand that, 1 in 5 people will experience depression in their lifetime. And I mean real depression, not just, oh, I'm sad. Wow. Yeah. So Chief Shea says that he had a similar experience at Bagana and it wasn't funny. No, it's not a funny experience at all. So 1 in 5 people are going to experience depression in their lifetime. And I'm not just talking about just, oh, my favorite football team lost, so I'm sad. It's different. Oh, I'm having a bad hair day, so I'm sad. Or, somebody did not greet me, so I'm sad. That is different. I know people use the word depressed. Thank you. I know people use the word depressed very, very easily, but it is totally different in this case. The real definition of the word depressed, if you break it down in the words, right, in the etymology of the word, means to be pressed down. So let's start with a definition that we can all understand. It is a persistent low mood affecting your thoughts, your behavior, your feelings, and your well-being, right? So we take that again. It is a persistent low mood affecting your thoughts, feelings, and well-being. It is extremely important for us to distinguish. Thank you for joining. It's important for us to distinguish between I am depressed, right? And I am suffering from depression, because I am suffering from depression is more intense and it lasts longer. Some people, I mean, there have been arguments about, oh, how long, if somebody has been going through depression, how long before you diagnose it as a case of either mild depression, chronic depression, or extreme. I'm looking at the definition, right? So you can now, the extreme one, you call it extreme. Sorry, guys, I had it written down somewhere. Extreme. I had it written down somewhere. I'm not sure where it is. Anyway, so it's the extreme, so that extreme major depressive disorder. I mean, they are all referred to as depressions, but they are in different forms, right? But the point is that just feeling, oh, I had a bad day is different from suffering and experiencing depression. So we need to be careful about how we use the words. Now, there are some subtypes, you would say, or subtypes, types of depression that are based off of causative factors. So I will talk about 3 types of depression. The first one is sad, but not sad the way we know sad, but sad as in seasonal affective disorder. In some parts of the globe, depending on the weather, in winter, some people really do experience a depression. It is normal and it has been diagnosed. It's something that people do experience in winter. That is when the weather is blue, it's cold out there, no sun, it's extreme. In fact, we've learned that the amount of sunlight that you receive affects your mood. So sometimes when you're feeling a bit blue, you say, oh, go out, experience nature, or go out in the sun, take a walk, because you find out that sunlight actually helps to improve your mood, right? Okay, so seasonal affective disorder is a real thing, and it is a type of depression. The second type of depression that we will talk about is dysmethia. Sorry, I need to spell it properly. Dysthymia, actually. It is a continuous state of depression which can last for up to 2 years. Yeah, it is chronic. It is chronic. It is a continuous state of depression which can last for up to 2 years. And it can be caused by a range of different things, and we're going to get to actual and practical causes of depression or this depressive disorder. The last type, so it's not that there are not other types of depression, right? But I'm picking out these 3 because they are common. Yeah, 2 years. They are common and you can easily spot them, right? And you can attribute them to specific causes. There is what you call prenatal and postnatal depression. And I put it to you guys today that even men can experience prenatal and postnatal depression. Not that they are pregnant, but they feel the feelings of their partner or their spouse while they are going through a depression. Prenatal is when you are pregnant, you have the feelings and symptoms of depression, which we will discuss very soon. Postnatal is when you have delivered and you have the baby, but you are experiencing depression. It can last you're laughing, it can last from birth of the child to up to 2 weeks, and even further if you do not quickly spot the signs and speak to your doctor. Women experience it, of course, even more commonly than men, but men do experience postpartum or postnatal depression. In fact, let me tell you guys that as a general rule, women will experience depression, whatever form, women will experience depression twice as more commonly than men. I don't know what it is, but I also believe that that's one of the reasons why strong women are truly, truly strong, because we overcome so many things. So this is not about women. So let's move on, right? Let's talk about causes of depression. Please remember that this list is not exhaustive. There are so many things that cause depression, but I have grouped them into different major categories, and it's something that you need to look out for. I want us to also know that, excuse me, I want us to also know that this live video or webinar is not just for if you are suffering depression. It could be for your friend or your loved one. So I want to encourage us to share it when we are done. Also, for you, let's say you are not suffering depression, but a friend of yours or a family member is suffering from depression. It's for you to know, to understand it, and know the steps to take to help that person, because we all need support in some way or the other, even if you're not the one suffering from depression, right? So let's move on. We have a lot to cover today. Let's move on to causes of depression. First one is situational. That's what I experienced, and that's what I expressed to you guys earlier on in the live webinar, where I talked about the experience that my family had with a flooding in our house. Life events in general can cause a depression. It could be, thank you for joining. It could be a series of normal and or temporary events. It could be you lost your mom, you lost a job, you lost somebody close to you, you gave birth to a child. We spoke about it in prenatal and postnatal depression. You are going through menopause. Maybe you're an older woman and you are going through menopause. You could be experiencing stress at work, at home, at school. You could have received a medical diagnosis. Maybe you hear that you have some form of fatal disease, right, or a very serious disease, and you are very, very extremely sad, persistently down and pressed down because of it. It could be as a result of bullying. Teenagers, young people, adolescents, they experience this a lot. They experience depression as a result of bullying. It could be a life event such as a sexual or mental abuse or even physical abuse. Young people experience this a lot. In fact, it has been proven that if you experience mental or physical or sexual abuse in your teenage years or in your preteen and teenage years, you are more likely to suffer from depression in adulthood. Also, maybe neglect by your parents, and any form of prolonged childhood adversity, right? So these are life events. These are situationally caused. I hope I'm saying the English right, but these are situationally caused. These are situational factors that cause depression, right? So that's one. Number two would be physical health problems. Maybe you're experiencing a health challenge. Maybe it's low blood sugar or high blood sugar. Maybe it's a form of pain that debilitates you in a sense that, oh, maybe you're not able to move. Maybe you experienced an accident and that has caused physical health challenges. Maybe you are experiencing shortness of breath or some form of cancer, something, a physical health problem can affect you mentally and emotionally and cause depression. Number three would be genetic inheritance. This one is twofold. It can be biology, meaning you picked up the chromosome, right, as you were getting it from your mother or your father. So this could be biological, or it could be learned. Because if for some reason, you've lived with a mom or a dad that experienced depression, you learn those behaviors, and you now start to manifest depression in your own adult life. So it may or may not be biological, it could be learned, right? Do you guys understand what I mean? Because your environment has shown you the way depressed people behave. Okay. Number three. No, so number three was, hi, thank you for joining. Beulah Shoyege Adewumi. Thank you, Jesus Sheung Abraham. Thank you very much for joining. I'm super happy that you joined us on Facebook. And then thank you to all those that are joining us on Instagram. So we were talking about causes of depression, yes? And number 4 cause would be lifestyle. Sleep, diet, exercise. That is extremely important. Those are lifestyle causes. And if you're not getting enough sleep, you are not eating right, you are not staying physically active, those can be, or that group of causes could affect or prolong depression. Thank you for the hearts. Very encouraging. Number 5 would be what I call personality indicators. If you have people that are quick to react to things that happen to them in life, or they are quick to be angry, quick to be sad, quick to be happy, quick to be down, it's what you would call emotional instability or lack of self-control. Okay, you feel that those people are on a roller coaster. They are more prone to experiencing depression, mild or chronic depression. And then the number 6 cause is medical treatments. Sometimes people are going through a physical disease or being treated for something physical, and the side effects creates depression in their, because it affects their mental, that is the brain. It affects the functioning of the brain. So there are drugs such as contraceptives. If you're trying not to get pregnant, it affects your hormone and it affects different neurons in the brain. There are anticonvulsants for people that do not, for people that experience epilepsy and regular cases of convulsion. There are some anti-migraine drugs that can cause depression, hormonal agents that can cause depression. So that's where you even talk about clinical depression, right? Because they are caused by medical treatments. Okay, these are just examples of some drugs that can cause depression. The other ones are too long or too hard to pronounce. Okay, then number 7 cause would be substance abuse. Alcohol in itself, first of all, slows down your brain. And if you are getting addicted to alcohol or even coming off an alcohol addiction, you could experience depression. Other forms of substances are drugs, stimulants, even coffee. If you are too addicted to coffee in some way, it has a way of affecting the brain. So stimulants, opioids, sedatives, as I said, alcohol, all these have a cause and effect relationship with depression. So as I said, this list is not exhaustive, but at least we have an idea of things that can cause depression, right? So I also want to mention that in some cases, in most cases actually, anxiety and depression can go together. But next week, we're going to be treating anxiety in depth, as well as panic attacks. Look out for that. But anxiety and depression in some cases go together. People that experience high cases of anxiety, always worried, always afraid, they feel like the world is out to get them, somebody is out to get them. Those people experience, they are prone also to experiencing depression. Okay, so we've talked about causes, we've talked about types, we've distinguished mild depression from clinical depression from chronic depression. So we're going to move on now to symptoms of depression. You may be experiencing it, or your loved one may be experiencing it. So please listen closely. The first one is that it starts with a feeling, or it's something that you can try to detect within yourself. You could be feeling down. I'm using some of the words that people when they are trying to really describe how they feel and they are being diagnosed with depression. These are some of the phrases and words, right? They feel down. They feel like they are shutting down. They feel like they are not capable of coping. They feel numb. They use the words like empty, dark cloud over their heads. They feel isolated. They feel like they are falling into a black hole. Those feelings are real. They are feeling it, right? They feel like maybe they cannot experience any form of pleasure, no self-confidence, lack of self-esteem. They feel hopeless. And lastly, it's an extreme case, but it does happen because suicide is on the rise. They feel suicidal. They feel like it's better for them not to be alive than to experience this feeling of being pressed down. Okay, so that's for feeling. Behaving. What you would now observe if you are not the one experiencing or suffering from depression, but you're looking at other people or observing friends or family or a loved one, you see that they behave in a certain type of way. They avoid or try to avoid social events. They try to avoid activities, things that they would have normally loved to do. I mean, you have somebody who is a star athlete and suddenly the person doesn't feel like practicing. The person doesn't feel like working out. That is, some of the symptoms that you will observe for people that are suffering from depression. Sometimes you observe that they try to harm themselves. Let me give you a true story. An adolescent in my, not adolescent, a young girl in my daughter's school has been experiencing. So this is my daughter, telling people about, no, telling me about her friend or her classmate. This friend wanted to harm herself. She actually walked into a pole just to, I don't know what it was, maybe to express herself, let herself go. I hear that's what my daughter says, that, sometimes she's up, sometimes she's down, sometimes they don't know how to relate with her. Most of the time she's in a black hole, in a down, most of the time she feels down. And that happens to people of all ages. It's not limited to teenagers or young people. People in their 30s, 40s, 50s experience depression. 60s, 70s, people experience depression. Okay, so other symptoms or symptomatic behaviors are loss in interest in sex. Your libido plummets. Some people that they were indulging in drugs and alcohol or cigarettes before, they tend to go intensely in that form of behavior. Physical aches and pains that do not seemingly have a cause. So let's talk about this one. Some people continuously, oh, my leg is paining me, my head is paining me. But if they go to the doctor, they cannot find out, or they are not able to detect and diagnose what exactly is the problem on the surface. But of course, if a doctor is really good, he now digs deeper, he asks questions, and it may be found out that the person is experiencing depression. Okay, restlessness, overexcitement. Even if sometimes when you're experiencing a depression, you now go to an extreme mood, the opposite of being super excited, and that happens some of the time. So it's almost like you are yin yang, like a roller coaster, basically. And or you're restless, you can't just stay in one place, or you drag your feet, that is, you are slow to do things, to accomplish tasks. You can't get yourself out of bed, or you cannot get yourself to take a bath. It does happen. People that experience depression experience this. Thank you for joining, Jessica. Okay, so we've talked about feeling, behavior, and then there are some psychotic symptoms, which could be delusions. Thank you, Jemjadi, for joining. You could see some symptoms of delusions, paranoia, hallucinations. People are hearing voices. It could be a symptom of depression. So there are so many risks to depression, but the first one would be that they isolate themselves. If you find that you isolate yourself a lot and you are experiencing those symptoms that I just described, then you need to take it seriously. It could also it could also further lead to self-harm. You may feel like cutting yourself, or banging your head against the wall, or whatever it is. That feeling of wanting to harm yourself is a complete and extreme risk for people suffering depression. And then lastly, it would be suicide. As I said before, it's super common now. It does happen, and we need to take it seriously. If people advance, FG, thank you. I believe you are greeting me, so thank you. If people advance in their depression, it can lead to suicidal thoughts. But I also want you guys to know that sometimes depression in itself can be a symptom of something else, a further or a more advanced emotional and mental disorder. Okay. It could be a symptom of bipolar disorder, where the person, as I was describing it that time, when the person is extreme, their extreme moods. Hello, thank you for joining. Thanks, Bookie. Extreme moods, you go from left, an extreme of being super, 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 super down and feel pressed down and under a dark cloud, to super happy. It's almost like your happiness is I'll use the word super again, but I mean superficial. It's like fake, it's forced, it's extreme. People are wondering, what are you so excited about? That is a bipolar disorder. Then you have what is called schizoaffective disorder. You guys know that. You may have heard of it before, where you have different personalities all in one, right? I'm just smiling because for some people that may be religious, they may feel that it is a form of spiritual something. Let's leave it like that, right? And then there is borderline personality disorder. So the concept or the experience of depression can be caused by different things, which I have spoken about. You guys need to watch the replay for those just joining. We've covered a lot, like a whole lot, right? But it can, as I said, also be a symptom of an advanced medical and mental disorder. Yeah, multiple personality disorders is the schizoaffective one that I had described, that I spoke about and tried not to over talk about. Okay, so we know all of the causes, types, risks, symptoms of depression. I'm sure you guys are looking forward to what are the solutions? What are the ways that people can help themselves, or in an extreme case, or in a case where it's prolonged, where they can speak to someone or take it further by getting medical help, right? So the number one thing, as I would always recommend, is for you to talk to somebody that you trust. I don't know who that could be. It depends on your life and your life situation. Talk to someone that you can trust. It could be somebody within your circle. It could be somebody neutral. I always recommend the Soul Clinic online. You can DM us. You can email us. You can send a private message. I need you guys to understand that we are training in these counseling techniques. We are learning how to prescribe the right solutions. But most of all, the Soul Clinic Online is a no judgment zone. So I may not even know you, which is all the better. But even if I do know you, it does not take away the help that we're here to provide. So you send a message, we talk about it, we maybe book a call. We book a call where you share, and then we can work through what you are going through. So that's talk to someone you trust. You could also, as a number two solution, try peer support. That is, other people that could be going through it. You could find out if there are support groups in your community, other people that are going through it. They gather together, they share their experiences, and then when you are in a community of people that may be also going through the same thing, you feel like you're not alone. Also, with regards to peer support, it could just be a community of your family and friends, just knowing that people are there for you. That is super, super important. Now, moving on to more practical ways for self-help for what we would call mild depression. That is a persistent, we're going back to the definition, okay? A persistent low feeling. Thank you for joining. Toot toots. A persistent low mood affecting your thoughts, your feelings, your behavior, and your well-being. So these are some of the practical ways. So we're on number 3 way of helping or managing depression. The number 3 way would be mindfulness. People speak about mindfulness, but hardly do they practice it, because mindfulness requires you to be present. Mindfulness requires you to be still, completely still. There are different mindfulness exercises, but the benefits are that you are more self-aware, you are calmer, you have the ability to choose whether you will respond or you won't respond, or how to respond if you do respond to something that you're going through. So mindfulness, it also helps you to be kinder to yourself. Mindfulness is just being present, listening to yourself, but you have to be intentional about it. You have to actually practice the mindfulness exercises. There are different kinds. You could practice mindful eating. For example, you take a piece of fruit. I was about to pick up the mouse and give you guys an example, but let's say you take a piece of fruit, an apple, a grape, excuse me, an apple or a grape, just as practice. And you can also Google YouTube videos on mindfulness, right? And you touch it. You're using all of your senses for when you're being mindful. You touch it and you feel, you want to know, what does the apple feel like? What's the texture? What's the color? You're looking at it extremely intensely. You're observing even how you feel while you're touching and looking at the apple. You smell it. Remember, you're using all of your senses. You smell it. What does it smell like? Sweet or sour or whatever. You hear it. Yes. You're wondering, is there any sound? Let's assume maybe you were eating granuts. You shake it. It may have a sound, right? But my point is, you're using all of your senses: sight, smell, taste, touch. Then you take a bite. we're talking about an apple now as an example. You take a bite. What is the texture? Is it crunchy? Is it soft? Is it hard? How does it taste when it gets to your tongue? I'm telling you, mindfulness, it seems like a very simple technique. It seems like maybe even a dumb technique, but it helps you to be more self-aware of the thoughts that run through your mind, your feelings, and emotions, how you respond to people, how you react to things that happen in your environment. Let's give another example. You can do mindful activity. So you're working out, for example, working out as in exercising, right? And you feel while you're practicing mindfulness, you think to yourself, how is my body feeling? Am I sweating? Am I experiencing any form of breeze, maybe from outside? Do I feel tired? What is my leg feeling like? Is it heavy? Does my arm feel like it can pull up one more piece of weight, right? But my point is, mindfulness is being present and using all of your senses. If you take a walk, you feel the sights and the sounds and the smells. Maybe it's sunny, maybe it's windy, maybe it's raining, so you can feel the drop of rain on your skin. I'm going deeper to give you more examples of mindfulness, right? So that you understand that you can use mindfulness in every activity in your life, and you can also practice mindful meditation. Yeah. And so it just helps you to be, as I said, to be more self-aware. Movement, eating, body scan. You can sit still and try and feel and experience. It's almost like you close your eyes. You want to know, how does my hand feel? Okay, it's not moving, but what does it feel like? My legs, are they twitching? What does that feel like? My thighs, are they heavy? Am I experiencing any pain or whatever? My point is mindfulness. Super, super, super helpful. Maybe we can talk about it. Actually, we'll talk about it in an emotional health hack, maybe in the coming weeks, so that we can discuss how effective it is. Speaking of an emotional health hack, the number 4 way would be journaling. And I believe that there was a post about it on the Soul Clinic online profile yesterday. It's journaling, writing out your thoughts. It can be seen as a mood diary. I'm going to answer that question. Thank you for that question, Dami. It can be seen as a mood diary, that is journaling. And so you're writing out the different thoughts and emotions that come to your head. In a day, in a week, in a month, you are able to see patterns, the highs and the lows. And then you can say to yourself, I may be improving, or I'm not improving, or I need to talk to somebody, or I need to go and see a counselor or a doctor, right? So journaling also helps you to be more self-aware. Number 5 would be stay active. Do something, join a group, try a new adventure, learn a new skill, go swimming, or try to go, learn swimming, learn how to ride a bike, do something, try a new thing, or try to volunteer. So me, for example, I am taking swimming lessons. Yeah, and I find it very, very relaxing. The challenge is really, really good. I'm learning new techniques. Or volunteering. I volunteer at my local church food bank, where people that are not able to afford meals come. They come for cooked meals. They come for groceries and all of that. And I feel much better. I feel more fulfilled when I help people out. So volunteering, being active, super important. Also, under being active, you need to set realistic goals, right? So maybe a realistic goal is, I'm going to get up and have a bath before 10 a.m. today. That may be a realistic goal. If, for example, you're experiencing depression in a way that you don't even want to do anything, you don't get out of bed all day, you sit down and think, or cry and cry. A realistic goal would be, I am going to get out of bed before 10 a.m. today. Okay, so, but whatever the case may be, stay active, and that also leads to physical activity. So that this one is self-care, physical activity. Oh my Lord. Sorry guys, give me 1 second. My battery is running low. Oh wow. Can I please just have 1 second? I really need to get a cord. Yay! I'm back. Okay, sorry for that interruption. So we were talking about physical activity, and I said that it's part of your self-care. Don't laugh, don't laugh. It's part of your self-care, making sure that you're exercising, you're getting enough sleep, you are paying attention to your personal hygiene, and also to your diet. Okay, so in terms of diet, did you know that getting your omega-3s, that's a mineral that is found mostly in fish, is really, really good for you. I'm back. So your omega-3s, okay, is really, really good for you. It's found in fish and then fruits and vegetables. When you maintain a good diet, you are less likely to experience depression. So, I mean, a good diet, um, eating right, combined with good physical activity, community involvement, not being isolated, the symptoms of depression tend to reduce. Okay. The next thing I would say is what is called cognitive behavioral therapy. So now we're getting a bit scientific. Okay, so I am not an advocate for just jumping to medication or antidepressants. So this cognitive behavioral therapy has been proven in some cases to be just as effective as drugs, and then the effects are more permanent. That is, this treatment, it has a way of lasting longer. People that experience depression and go through this treatment, they are less likely to experience continuous depression. Okay, so what you guys would know is that I mean, we can go into it later on. And I mean later on, I mean maybe in another live session, but it is computer based in most cases. It is usually prescribed by a doctor, a therapist, or a licensed counselor or coach. It is more action oriented. So that means the therapy is not going into your past. It's not asking you questions about things that happened in your past. It's more present and action oriented. You get to examine your present thoughts, and it's like it's based on the theory, I should say, that your thoughts affect your feelings affect your behavior, and then your behavior can affect your thoughts, which can also affect your feelings. It's like a cycle. But when you learn how to nip it in the bud, right, starting from your thoughts, then you are on your way, you're making progress to overcoming depression. Okay. So you can actually Google it. It's called, I will say it again, cognitive behavioral therapy. And then lastly, it would be medication. This can only be, please, it can only be prescribed by licensed therapist, licensed psychologist or psychotherapist. Okay, and so medication, there are a number of different types of medication and antidepressants out there, depending on the level of the depression. Such as we said, it could be mild, it could be chronic, it could be extreme major depressive disorder. Um, the psychotherapist, the licensed person, the licensed doctor will recommend the type of medication that is right for you. Sometimes also the licensed psychotherapist or psychologist could examine the current medication that you are on and say you need to come off certain types of medication. That also could be a part of the solution for depression. What to do if your friend or family member, that is, if you are a friend or family member or a loved one of somebody experiencing depression, what to do? The first thing, as I said, is do not say cheer up, please, because feeling sad is different from experiencing or suffering depression. And so sometimes the person that is experiencing depression cannot just cheer up. It's not that automatic. It is so much of a pressing down and a dark cloud over the person's head that just thinking happy thoughts, just watching a movie will not help. Just listening to music will not help. Okay? So that's number one. Don't say cheer up. Don't snap at them. Don't be impatient with them. Because you're not experiencing it, you have no idea what they are going through. The second thing I would say is support them in getting help. If they need help, support them in getting help. Be there for them. Let them know that you are there for them as unjudgmentally and as neutrally. I hope I'm even using the right word, as possible. Okay, that is based off of your listening skills. So you need to listen. Don't just talk if somebody's trying to express to you what they are going through, and you may have noticed the symptoms, right, that we had earlier described, and you need to and you need to listen for them to express themselves, to share their feelings. Listen more than you speak. But when you do speak, the number four thing I would now say is be open about your own emotions. So share with them something you've experienced too. That helps them know that, you're open to discussing it. It lets them know that you're not shunning them out. It lets them know that you're not placing yourself on a higher pedestal. Anybody can experience depression. And as I said, the statistics is that 1 in 5 or even more will experience depression in their lifetime. And then don't be critical. We've said that. Don't be critical or judgmental of them. They're experiencing something that you may not have experienced, and you cannot just prescribe a solution or a one size fits all. Even if you've experienced it, what may solve their problem, what may have solved your issue, may not be the same as what solves theirs. Okay, and then keep in touch with them. As I said, letting them know that you are there for them, super important. Lastly, I would say keep a balance. Because you want to help, you may say, oh, if the person is your family member or close to you, you guys live in the same house, you may want to do everything for them, cook their meals, wash their clothes, or you come from your own house and come and help them. You need to keep a balance. You need to identify things that they really cannot do for themselves based on their mental and emotional state, and the things that they can push themselves to doing. For example, taking a bath, cooking a quick meal, right? Heating up or microwaving their food. They can do that. But the point is, keep a balance. Know what you're helping them with and what they can push themselves to do. That is all for today's webinar. I think we exhausted a lot. For those just joining, thank you very much. But I recommend that you catch the replay. Damsel Dami has a question. She says, does depression affect the function of the body organs, eventually causing someone to be sick? Yes, Dami. Yes, that happens. Now let's talk about it. Your mind has a way of affecting your body. You can feel super happy 1 minute, that is in your emotions, and you're motivated to go. You're motivated to do one more press up, even if you are feeling really like, yeah, you can't take it anymore. But someone says something that just pushes you, sparks your emotion, sparks this, you can do it, and you actually do it. That's just a broad example. Your mind affects your bodily function. People can feel and think about sickness to a point where they manifest the sickness in their body. In fact, when people are being hypnotized, thank you guys. When people are being hypnotized, when they are experiencing, or they're going through a hypnotic session, they can think. I've seen it happen. I've seen a video. They can think about bleeding to a point where they actually start bleeding from their skin without a cut, without a scratch. They actually experience bleeding. Your mind is super, super, super powerful. Okay? So it does happen. People can, say, oh, this cold is going around, right? This cold is going around, it's going around. Ah, my friend is sick. My husband is experiencing blah, blah, blah. And without, hi, thank you, Ikekpo, for joining, but you will have to catch the replay. We're almost done. So you can actually think yourself and feel yourself into physical sickness. It is possible, but it's the same way you can also think yourself into getting well. It does happen, and I do plan on treating that topic in depth in later weeks to come. Yeah, how the mind affects the body. Do we have any more questions? So just a quick go over. We spoke about depression. We distinguished it: mild depression, chronic depression, clinical depression. We also talked about different causes of depression, life events, physical health problems, a prolonged childhood experience, if maybe not even childhood, but something that happens to you in the present, some form of abuse, neglect, or rape. It can cause depression. It could, loss of a loved one, loss of a job, financial issues, all those things. That's what we call situational depression, and it can cause depression. We also talked about the fact that some forms of depression can be caused by a medical treatment, a drug that has been possibly prescribed that you are taking. An example is a contraceptive because it disturbs your hormonal balance. We also spoke about substance abuse, where you abuse cigarettes or narcotics or alcohol that can affect the neurons and the hormones within your body, and that can lead to depression. We also spoke about other causes of depression, like it could be genetic, inherited, biologically, or through learned behavior, what you've observed living with maybe a mom or a dad that experienced depression. You can start to manifest those symptoms also. So there are different causes of depression. I encourage you to catch the replay. We spoke about the risks of depression. We spoke about the extreme and very common one, which could be suicide and self-harm. We spoke about types of depression: seasonal affective disorder, dysthymia, which is a continuous depression, chronic, that can go all the way to 2 years. We spoke about prenatal and postnatal depression, and we said even men experience this form of depression. And then we moved on to symptoms, feelings that people experience, feel, people that are experiencing depression, the feelings that they feel in their head, behavior, things that you will observe from the outside, and then psychotic symptoms. It can be as bad as them hearing voices, hallucinating, experiencing paranoia.